Welcome to the Art of Patient Communication. Today, we will be talking about the topic Unravel the Gravel. To begin with, I would like you to imagine a patient sitting in your chair who's talking a mile a minute. They're giving you everything, a mixture of emotions, their problem, their beliefs, their complaint, their fears. And that is the gravel, the broken pieces that we are trying to unravel. And why do we actually have to do that? To create a smoother path for the patient so they can get their treatment done. All they are trying to tell you is in that big gravel is what their concerns are, what's been bothering them. There could be a lot of guilt in there as well for either not seeing you enough or not attending to their issues earlier enough. So, our job is to help them unravel that and solve that. And this is our job. And in that mixture of emotions, they also give you a lot of fears, mind you, which are not logic based. And our job as a health professional is to give a cascade of logic to that fear. Because once you put a logic behind any fear, it doesn't exist anymore. So that's all you have to do. And you have to simplify the complexities in the treatment that you are going to execute. It's actually not about the treatment itself, of how simple or how difficult it is. It is how the patient is actually perceiving that treatment. And if, as a health professional, you can simplify that to them in simple words, you have won their trust. Because when you can simplify it, they see three things. You have done this before, you know what you're doing, and you're confident. If you do these three things, you won their trust. So let's get right into it. Let's begin to see how the problem actually presents itself. So bear with me while I actually going to do a dual role of the health professional in the chair and a patient on the other side. And also, I would like to flag that because my clinical experiences all come from dentistry, so I will be giving you a dental example, and I'm sure you can find pieces that relate to you from your profession. So imagine I have Mrs. Smith who has presented to me today to see me. So as a health professional, I begin to say, hi, Mrs. Smith, how are you today? How can I help you? Now, Mrs. Smith, who is about, a 70-year-old woman, she is sitting in the chair and this is how she says, oh, look, I'm in a lot of pain today on my lower left-hand side. I just haven't slept at all for the last week. I just don't know what to do. I haven't been to a dentist in the last 8 years. And in the last 18 months, I've been looking after my unwell husband. And I'm just very, very stressed. I went to the doctor yesterday to see if I had an ear infection, but the doctor wasn't sure. The medications that he's put me on, he's also considering to change them. And yeah, look, I haven't been to a dentist in 18 months and I've had problems before and I've just ended up having them removed. So don't have any back teeth to eat on. And yeah, I was talking to someone and they've had dentures. They don't tell me good things about it. So I don't know. I also wake up at night sometimes with a dry mouth. Oh, I guess I just have too much stress, lots going on. So here I am. I just want you to have a look and tell me what's going on. And yeah, just have a look, please. This is how it actually presents. It is a mixture of their fears, as I said, their beliefs, what they've heard from other people, pain, and a lot of guilt. Clinically, this problem can be, or mechanically, I should say, this problem can be solved very quickly. You lay the patient down, and you look in their mouth, and whatever is the most obvious thing, you tell them that I can just take one x-ray and these are the two options, this is how much it will be, and then black and white, done, right? The question here is that, did we solve the bigger problem? Did we actually connect to the patient? Did we explain them what's going on? Did we make a path for the patient to build relationship with you and come back and see you? Did we bank on that opportunity that we had to see a human being in the chair? So let's just try to take a step back here. So when the patient is telling us all of this information, depending on the day you are having and depending on your clinical experience, it is quite overwhelming for a clinician as well, because you become tangled up in a thought process in your head that what does actually the patient want? Do they want me to do a checkup, or do they want me to have a look at the pain? um, what is with the doctor's appointment? Where does a thirst, dry mouth come from? She mentioned something about the medications and she's got stress, and all of a sudden we take all of that in us and then we are like, whoa, I don't know what I'm meant to do. And that is where what I'm going to tell you next is going to really help, is that is very, very common to experience that from a clinician's perspective, because it's a lot of information to take in. And you obviously mean well for the patient, and that's why you feel stressed and you don't know where to begin with. And this is when I would like you to think at this situation metaphorically, that patient in the chair is actually playing four different radio stations. They are broadcasting four different radio stations. So first station is talks about the chief complaint. What is their problem? Why are they here today? They have been highly stressed, they have been in pain, and they have been looking after their unwell husband, but they are in the chair now because of something. That has to be our highest priority. They are in pain. That needs to be dealt with, whether it's in the form of treatment, medication, whatever that may be. That is our priority today. So that channel is called the chief complaint channel. The next channel is the adversity channel. So the adversity channel is the channel where they are telling you what's actually happening in their life. Why are they stressed? They have an unwell husband at home. They've been a carer. They haven't been looking after themselves. That tells you the stress levels. So the third channel is the reality channel. So the reality channel is their medical history, or why they went to the doctors, what medications they are on, whether they are getting dry mouth, and she mentioned about the missing teeth. She mentioned about not having dentures. All of that is the current reality, is the patient's reality. And these are the facts that we actually incorporate when we are presenting to the patient their treatment plan. And the last channel is the emotions and beliefs channel. So this channel is all the information that they're giving you either from their past experiences or from what they have heard. And our job with that fourth channel is to listen to those, whether they are myths or stories, to them one by one and address them. And these can also be like little mumbles. They may just say it under their breath, or they may just pass it as a comment. It's important to tune in into them and respond to them even quickly, making sure that that makes the patient feel that you've actually heard them. You were not there with your own agenda and just trying to get the patient in and get the patient out. You've actually listened to them, you've heard them, you have gone step by step solving their all the concerns. In the bigger picture, if you think about it, what you're trying to do is that Mrs. Smith has a lot of noise in her life right now. There's a lot of chaos, and all you are trying to do is that you cannot solve that chaos, what's happening externally in her life, but what you can do is you can give her clarity and a path in the field where you are, and which is where that's why she's come to you to see you, so you can give her the clarity in that area, but at her terms, not at your terms, at her terms, where she is. Meet them where she is. not where you are. Let's break it down step by step as to how are you going to manage this situation, as in what are you going to say to the patient and how are you going to manage the patient step by step so she feels organized. The first thing is to manage yourself. So, as I said, the four radio stations that I talked about, that's purely how you are dividing things in your mind. They are not to be spoken out loud. That's the maths, or that's the division that you are doing in your head as the patient is speaking. Now, mind you, with practice, that division starts to happen in the matter of minutes or in the matter of seconds. And you will be in control of the situation, but it will take practice. And if you start doing that, I promise you, you will not forget anything. You will take it all into account. So, yeah, so when you are actually delivering, when it's your time to say something to the patient, that's when you, first of all, manage yourself. So, yes, you are overwhelmed. Yes, you are stressed. And yes, you want to help the patient. But again, you need to tell yourself that I am going to think logically at this point and not emotionally. Mrs. Smith has a lot of stress in her life, and my job here as a health professional is to give her a clear path, and that is what I am going to do. It's not about me, it's about Mrs. Smith in the chair. If you tell yourself that, it will be very easy to move forward and not getting bogged into the situation you have at hand. Let's begin with the four channels. So I'll give you an acronym. It's called CARE. So the four channels were chief complaint. C stands for chief complaint. A stands for adversity. R stands for reality. And E stands for emotions and belief. Beginning with the first channel, chief complaint. Now, the chief complaint channel can be mixed up with the third channel, which is the reality channel. So C and the R go hand in hand. When you are talking about the chief complaint from the with the patient, you explain them, you show them the investigations that you have already done. So when we are giving the patient the diagnosis, we usually just do the medical diagnosing technically in our head and we spit out the diagnosis to the patient. It is important to walk the patient through the diagnosis if you have one, and if you cannot make up your mind, or if you have a differential diagnosis, as we say when we don't have a set diagnosis, it is important to walk the patient through both the sets. If you know why you think patient has a certain situation, you need to say, on the x-ray, this is what I see. In your mouth, this is what I see. Mrs. Smith, this and this adds up. The tooth is tender to tapping when I tap on it, and on the x-ray, I see a gray shadow at the base of the tooth. That tells me this tooth has X, and the treatment for this tooth will be Y and Z, explaining them the cost. If you cannot come up with a diagnosis, for example, again in dentistry, we get areas where a patient would be in pain, and when we look in their mouth, we just cannot pinpoint the diagnosis to the patient. In that case, we still walk the patient through your thinking process that I can see one sign, but one sign is not enough for me to make a confirmed diagnosis. So, this is my strategy moving forward. We are going to wait and watch. I'm going to review you next week. Or if I cannot find a diagnosis, I will refer you to a specialist. So, that is the thinking process that we all do. But it's important to bring the patient into that insight so they know that you've actually heard them and you have thought about it and you are actually taking your time to explain it to the patient. Again, what this does is it tells the patient the three things I said before, that you've done this before, you know what you're doing, and you're confident. And doing this will build trust. Then, when the second channel comes in, so obviously, in the first situation, when I said that the two options to treat the tooth, one is, say, a root canal treatment, and second is, patient can have the tooth removed and extraction. Now, this is when the medical history, the reality channel comes into play. When the patient is telling you about the medical history, I've been to the doctor, I'm on these medications, so the doctor is about to change my medications. I don't have my back teeth. I get thirsty at night. These are all the facts that you need to dig into them more by asking more questions. Like, what medications are you on? Why are you on them? And those medications will then get incorporated in your treatment planning, and it will actually narrow down the treatment options for you and for the patient. And these are the facts which you bring in when the patient asks you the question after you've given them all the options. It's a classic question when the patient asks you, "What would you do in my situation?" That's when you bring in again all the facts one by one. "Mrs. Smith, you don't have back teeth. You are struggling to eat. You're getting stressed, and we need to treat these teeth so you have more teeth so you can eat. You're getting dry mouth. You will probably struggle with dentures. Who knows? Maybe the dentures, maybe she won't be able to cope with dentures. Maybe she has had a denture in the past, which she struggles with." So, again, questioning these things will actually lead you to a path of a smoother treatment planning process for you. And I think while you are making the treatment plan for the patient, it is also important to talk money. I don't know about other sectors, but in dentistry, there's two things: there's discomfort and money that people are, or the patients are really worried about. So it's important to talk about money openly and honestly to the patient and ask about where they are, how much they want to spend, what is their budget, rather than me imposing my targets on the patient. So ask the patient what's their budget, how much they want to spend. If they have a limited budget, maybe they are better off spending the money in replacing their missing teeth. Or if they can afford the treatment, yes, then they can go ahead and spending that money on that tooth that they want to keep. So it all dictates around the patient. We have to meet them at their terms, not at our terms. So that's the two channels that we've talked about. We've talked about the chief complaint channel and the reality channel, that we have to weave them together. The next channel is the adversity channel. The adversity channel, it just really points out to you how important it is to treat their first channel, which is the chief complaint. Because in stress, when the patient is in stress at home, they are not thinking straight. If they are in pain, they are not sleeping at all, which means, again, everything seems way more amplified and bigger than it is. So again, this also leads you to treat the chief complaint on that day. And the fourth channel is the emotions and the belief channel. So in this channel, you have to focus on whatever they have heard or they've expressed in little bits, like, "I have heard that dentures are no good," or any comment like that they have heard. So this is where you actually go in and you dig in and ask more questions to gain more clarity about what they have actually heard. For example, we don't know if they have spoken to a patient who had full lower denture, which for real, they don't have a good reputation. So if that's the case, you tell them that. If a patient says to me that dentures don't have a good reputation, I acknowledge that. Yes, that is right. It is a foreign object in your mouth, and you will take some time to get used to it. So set realistic expectations. But Mrs. Smith, there are ways that we can make your experience better to improve your lifestyle. So set the expectations right. Don't give them a rosy picture where there isn't one, but walk them through their emotions and their beliefs of wherever they have a problem at. Once you have addressed all of that with the patient, you will find that the patient will already be a lot more comfortable talking about the budget with you, money with you, their concerns with you, and they will be a lot more open now because you've actually listened to them, connected with them. Once you have spoken to the patient about, once you've heard them about what they want, how much they want to spend, and now you know what the patient's expectations are and what they actually need in terms of the treatment, this is an opportunity where you actually put the treatment plan on the softwares that you have. You've done that. Then divide that into visits, keeping their budget in mind. Walk them through that printed treatment plan. Make their appointments, whether you do it or your admin team does it, doesn't really matter. Get them organized. And when you are, walking them out to reception, you make sure that the patient knows the path moving forward, whether they need to come back to you 3 times, 4 times to finish the treatment. Make sure that's all done and organized. Because if you have organized the patient, that means that's one less chaos that the patient has to think about. And hence, the patient will feel that you know what you're doing, you've done this before, and you're confident. And that will build trust. Thank you for listening, and I hope you got something out of it. Follow me on Instagram and do not forget to subscribe to my channel on YouTube. Bye.